Let's have some straight truth about healthcare reform. What's with you people anyway? You carry on like a bunch of cats. Well, we bovines can tell you a thing or two. In Europe, our fellow herds have enjoyed healthy herd care for decades, and look what they've got to show for it. For some reason, everybody's chewing their cuds over costs. Well, what about your health? Shouldn't the real issue be about the effects of health reform on your lives, not your pocketbooks? These are the facts. Over the last 20 years or so, the European Union countries with their variably socialized healthcare systems have reduced all disease mortality to an average of 47%. 47! Now that's something to chew over. And there's more. In England, for example, since 1980, they've managed to reduce your risk of death from that number one killer, heart disease, by 39%. And that's with waiting weeks for surgery or a cardiac stent. It doesn't seem to hurt to wait. Cows always wait online. And cancer, scary cancer, all cancer survival in Europe is 47% for men and 56% for women. 77% of men enjoy 5-year survival for prostate cancer, 65% for colon cancer, and women, we can look forward to 79% 5-year survival rates for breast cancer. And I won't even get into infant mortality rates. No wonder the World Health Organization rates American healthcare 37th in the world.
Meow. Wait a minute. Just wait a minute, you cow. The World Health Organization? Give me a break. The World Health Organization factors social political factors into its analysis. That means, yeah, you get it. Basically, statistical analysis by hidden agenda. I mean, do you really want to go to Colombia for your health care? Well, Colombia is one of the countries they rank us with. And as for infant mortality, no two countries reported it alike. And most conveniently leave out of their counts those high-risk infants the U.S. honestly reports. In fact, if we did it all the same, the analysis would place America near the top. But you won't hear that from this administration. And just like a cow, you only chew what's fed you, like one-sided statistics. The rest of your celebrated facts are this, and listen closely, cow. Of the 10 Englishmen you quote, your celebrated England with its celebrated socialized medicine system that you'd like to mimic, of the 10 Englishmen in 1980 who would die of that big killer heart disease, as you call it, 6 will still die in 2009. 6. In America, the greedy cardiologists with their aggressive interventional approaches and their aggressive preventative medicine have reduced mortality by 60% since 1980. Yes, only 4 of the Americans will die. Less than half. In cancer, it's even worse. You're bragging about a 47% 5-year survival for men and a 56% survival for women for all-cause mortality in cancer. Well, in the U.S., it's a whopping 65% for everyone. And that's because everyone, poor or rich, has access to all those expensive tests and procedures they ration in Europe. And the much vaunted Canada? Don't get prostate cancer there, because you have 185%. Yes, you heard that correctly. 185% greater chance of death versus your American neighbor. In fact, American men, you bulls out there, you have a 99% chance of survival. There's no other country that even approaches that. Colon, breast, they are all considerably worse in Europe and Canada, and for the same reasons. In Germany, women have a 50% higher death rate from breast cancer. In England, oh my God, it's up to 88%. And the list just goes on from disease category to disease category. Along with your cud, chew on that, my friend. Those are the real facts. And you won't hear it from the Obama administration because they're inconvenient facts. So the next time some cow wanders by ruminating about how much better it would be under a semi or fully socialized system, just think about that. Do you really want a 47% reduction in mortality? Or do you want to enjoy something over 50 or 60% like we have here? Yes, that's American healthcare. It's no secret and it's no mystery why people all over the world come here for advanced care. And it's no mystery why doctors from all over the world come here for training and advanced training. Because America and American medicine is in the forefront, and there's a reason for that. Because private enterprise, private motivation will always be the generator of the most advanced kind of system, whether it's general economics or it's the medical care system. But you won't hear anything about that from the Obama administration. No, our president will get up and trash everything. He'll cite only the few statistics that are adverse to the image of American care, and he'll ignore everything else. And you cows just chew it all up. Well, we cats, we're not interested in being herded. We want individualized care, we want individualized insurance, and we want to pay individually. And that's how it should be. So Americans, are you going to be cats or are you going to be cows? Send your meows to Congress and tell them to stop and think about rational health care reform.
Oh, stop the meow. I didn't hear any of that from Obama, and if he didn't say it, then it can't matter. American healthcare stinks, just like he says. I'll take that 47% mortality any Americans, day. Let's change the way we do medicine. It's time. Come join the herd.